Hello, this is Aishwarya and a very warm welcome to another episode of COVID-19 Bulletin. The top story. The Government of India will provide free corona vaccine to all Indian citizens above 18 years of age in the country from 21st of June. Prime Minister Narendra Modi made this announcement during his address to the country. The Government of India will procure 75% of the vaccines from vaccine producers of their total production and provide them free of cost to the states. Earlier, the states were responsible for 25% vaccination, but now no state government will have to spend anything for vaccines. However, the system of direct purchase of 25% vaccines by private hospitals will continue as before. Private hospitals will be able to charge a maximum service charge of 150 rupees on the fixed price of the vaccines. The revised guidelines of the National COVID Vaccination Program to be implemented from 21st of June have also been issued by the Government of India. According to these guidelines, the allocation of vaccine doses to the states and union territories will be done based on the population of the area, infection data and vaccination data. During his address to the nation, the Prime Minister also informed about the progress related to the development of new vaccines. The Prime Minister said that at present, 7 companies are preparing different types of vaccines in the country. Vaccines for children and the nasal vaccine are also under trial. Moving on in the bulletin now. A repurposed drug named niclosamide may soon be used for treating COVID-19 patients. CSIR along with Laxai Life Sciences Private Limited has initiated phase 2 clinical trials to test the efficacy of this drug in treating COVID-19 infections. If the trial results are as desired, we will soon have another drug in the COVID-19 treatment basket. Niclosamide isn't a new drug. It was already being used to treat tapeworm infections in adults and children. The good thing is that the safety profile of this drug has already been tested and it has been found safe for human use. The drug is generic, affordable and easily available in India and therefore can be made available to our population as soon as the positive clinical trial results are out. The drug was picked for clinical trials as studies have shown that it can help in reducing the formation of syncytia, which are structures also found in the lungs due to COVID-19 infection. Also, a research done by scientists at the CSIR Indian Institute of Integrative Medicine Jammu and National Centre for Biological Sciences Bangalore demonstrated through laboratory studies that the drug inhibits coronavirus infection by blocking the viral entry through pH-dependent endocytic pathway. Now that the Drug Controller General of India has given permission to conduct clinical trials of this drug, the clinical trial has been initiated this week at different sites and it is expected that the trial will be completed within 8 to 12 weeks. So let us hope that the drug turns out to be effective against COVID-19 and we have another treatment option available for COVID-19 infection. On to some other news. A piece of terrifying news, or more appropriately, a rumor is doing rounds in the country. The news says that the children will be impacted most by the third wave of coronavirus in the country. To clear the air, Dr. Randeep Guleria, Director AIIMS Delhi, told at a press briefing that it is a piece of misinformation that subsequent waves of the COVID-19 pandemic are going to cause severe illness in children. There is no data either from India or globally to show that children will be seriously infected in subsequent waves. Dr. Guleria further said that 60 to 70% of the children who got infected and got admitted to hospitals during the second wave in India had either comorbidities or low immunity, and healthy children recovered with mild illness without need for hospitalization. Citing the example of Spanish flu, Dr. Guleria further explained that pandemics caused due to respiratory viruses occur in multiple waves when most of the population is susceptible. However, when a large part of the population acquires immunity against the infection, the virus becomes endemic and infection becomes seasonal. He also mentioned that the waves occur due to the new emergence of variants of the virus. Stressing on the need for COVID-19 appropriate behavior, he re-emphasized that if we have to stop subsequent waves, we need to aggressively follow COVID appropriate behavior until we can say that a significant number of our population is vaccinated or has acquired natural immunity. Well, that is all for now in this bulletin. You can share your feedback and suggestions to us on the email ID flashing on your screens. And for more such videos, download India Science app or visit our website www.indiascience.in, and don't forget to follow us on our social media as well. We'll be back with another edition of COVID-19 Bulletin soon. Take care and stay safe. Bye for now.